radiofrequency. Radiofrequency is energy that is delivered to cause an injury and tighten, heat and tighten. So we have radiofrequency energy that we can do through skin and deliver energy to the deep layer of skin, so that deep layer of collagen tightens up a little bit. And how do you see that? You see that as an improvement in skin tightness. Now, here's a couple things about these radiofrequency energies. We've got quite a few of them. So one can just go through skin. We've actually had thermage in our office, I think 13, 14 years. It's great workhorse, great, no downtime, no healing time, little sore to do, but we have laughing gas, so everyone loves it now. And then we have ones that can go a little bit deeper. Okay, well, we can deliver it with micro needles through the skin. Again, when you're doing multiple little needles as opposed to deep cuts, your skin isn't all damaged, it's more bruised, and it's easier and quicker for it to heal. But then now you're delivering that energy deeper. And we have a couple of systems like that. We have Morpheus, we have Fractora, that we can deliver a little bit more skin tightening in those with that technology.
What's the difference between those, Dr. Khanna? Like, because that can be confusing to patients, is that it on the surface they all sound similar. They're all microneedling and they're delivering that radiofrequency treatment down below.
How do we pick and choose? We pick and choose based on skin coloring, desire, depth. So each one has a different platform and how deep we're going. Are the tips, are the little needles coated? Somebody with darker skin like me, if I get a zit, it goes brown. So if you did multiple needles, you would get brown dots here. So you have to use a system that has a covered tip, so I'm not getting heat energy on the skin level, only in the deep. So you're picking and choosing the different technologies on areas you're treating, the skin quality you're treating, the skin color you're treating, and the depth and the downtime that you're looking for. So the next thing is what probably is verging on the surgical side, the fun side, I always say, under the skin radiofrequency. So the idea is to heat the deep side of the skin, or what we call the deep dermis, with these technologies. Well, what if I just go to the deep dermis and deliver it? And basically we're using almost like the inside of a pen, a very thin filament, make 3 little needle holes, local freezing, and deliver that energy, particularly from the corner of the mouth to the first line in the neck, in that whole zone, especially right here. And we have things called Thermi, Face Tight, Renuvion, all different levels of energy. Some are stronger than others, and we pick and choose what's right for the individual skin type and the amount of energy that I can deliver and the amount of result that we're looking for in that zone safely. But that is a little bit of a procedure. That requires one of us, Dr. Z or myself, doing that. But it's nice because it's local and it's 3 little stabs. So it's what we call minimally invasive. Buys time. You know, the goal is you don't want to have a facelift every 3, 4, 5 years. You know, we say on average it lasts every 8 to 10. Well, guess what? It will last 10 if you do maintenance. And maybe it's thermage once a year. Maybe it's every other year you do Face Tight or Renuvion underneath the skin, and then you're maintaining it. Good health, good exercise, not smoking, and sunscreen.
And a lot of times we actually do, in certain cases, complement these exact same treatments along with surgery as well. So it's not a one or the other. A lot of times they are combination treatments that, again, we will discuss with you based on the consultation, the actual, concerns you have and what the goals are for you. So as Dr. K mentioned, all of the treatments that we discuss are performed in the office, some of them with freezing, and all of them, we always have the nitrous oxide or laughing gas available for additional comfort. People do love that. And then the healing can take anywhere between 2 to 3 days to 1 to 2 weeks, again, depending on what modality we're using, how aggressive we're being, what's the final product that we want to achieve. And the effects can be similar to something like taking back the clock 2 to 3 years on your skin, sometimes even more depending on what we do. So really great options to consider, and to just know that it's not one end of the spectrum or the other. It's not just skincare or facelift surgery. There's a lot that we've evolved in between and have to available for free.
And that's what's fun about having a lot of technology in an office, because for us, even if you watch the next facelift video, when we do facelifts, we are using this together, as you said, Dr. Z. So important, because skin removal is not the same as improving skin quality. So you combine these things to get the best result for every patient, what every patient needs. So thanks for joining us here today. Don't forget to send us your questions if you have anything that you want us to talk about.
We hope this has been informative for you. And if you like what you've heard, make sure to subscribe below and recommend us to your friends and family as well. And stay tuned for the next episode where we discuss some more of the surgical side.